I'm Dr. Petty with Carolina Chiropractic. I'm here today going to be performing Webster's Technique on my patient who is 25 weeks pregnant. And we're going to talk a little bit about that, but I'm going to let you talk about what's been going on with you first.
So this is my second pregnancy, 25 weeks in now, and I had a little bit of sciatica, a little bit of left side round ligament pain, S1 joint pain, or SI joint pain, and it's hit earlier this pregnancy than my first pregnancy. So this is my first time getting chiropractic care. And
you didn't get it with the last pregnancy?
I did not get it with the last pregnancy, nope. And so we are about 4 appointments in, and I have been feeling great to the point of forgetting that I have chiropractic care coming up. So
the round ligament resolved, the low back pain resolved, all that stuff.
Absolutely.
And you're kind of on par for getting round ligament and all that stuff. Typically that happens somewhere in the neighborhood of 18 to 20 months. Some people it happens beforehand, some people it happens afterwards. Second pregnancy, especially close together, you know, it does make that a little bit more likelihood. And then I'm going to show how to KT tape for low back pain with pregnancy and everything else afterwards, okay? Like I said, I'm going to use Webster's Technique with you. How's that, comfortable or no?
Yep.
Okay. So neck and everything is also less tight and tense and whatnot, correct? Good. So we're just going to check a couple things, see how everything's moving, because it's been a couple weeks since I've seen you. I'm just following up to make sure that everything maintains the way that it needs to so that you can progress properly. I never use the words more pregnant, even though I've heard people say that, because you're as pregnant as you're going to be right now. You have as many babies in there as you're going to, right? I don't think they're putting any more in. So what we'll do is pretty simple. We're going to take a deep breath in here. I'm going to adjust your mid back and all the way out. Good, relax, right? Good. Breathe in again and all the way out. Good. How'd that feel?
Good.
Now with pregnancy, you kind of almost slide down towards your hips just a little bit. You actually have to be a little bit more careful adjusting them because a hormone named relaxin is released the whole time during pregnancy. And so because of that, it's causing the pelvis to spread. This is going to drop down like that. I'm going to go right here on your SI joint, which stands for the sacrum, and then the ilium. We're going to go right, good, and right, good. Do that one more, okay? Good. How'd that feel? Good. Lie on your side facing me. So relaxin makes all the ligaments more loose, and because of that, you're actually easier to adjust and harder to hold an adjustment and everything else. But that's why I say you gotta be a little bit more careful because you don't want to over adjust. That's why you want the specialty of Webster's Technique. Just relax right here, nice and easy. And we put a little impulse right here in your low back. Good, one more time. Good, and roll to the other side for me. All right, then we're gonna bring your arms right here. Nice and easy. Relax right. Good, lying back. Did I knock the air out of you on that one a little bit? There's no room for your belly to go other than the diaphragm. But it did move. I don't know if you felt that or whatnot. Okay, sure, I figured you did. So what I always like to do with this is I always like to stretch the hips because I want to get them ready for movement and everything else. There's a stretch I can show at the end of this as well. Is there a yoga name for it? I can never remember it. But it's very helpful for stretching the pelvic floor, which helps get the baby, get it ready for pregnancy and everything else. Get it ready for delivery, I guess is what I'm trying to say. Sorry, it's hard to talk with the mask on. Yeah. You know, you would think, what am I, 13 weeks into this wearing a mask in practice at least, you know? And so then I kind of come up over here towards the ligaments. I just kind of do a little bit of soft tissue massage right off the pubis bone all the way back to the ASIS, which is called the anterior superior iliac crest, if you want to look all this stuff up, but not a hard thing. So the pelvis is shaped like a bowl, and what we're trying to do is make sure that these ligaments move nicely. I'm going to check 4 spots in the pelvis. Let's check for tenderness. Ready? 1, 2, 3, and 4. Any of those tender? Okay. All right, good. We're going to stretch this leg all the way up, across. And then right through here. And then your adductors, they always compensate for the pelvic floor. If you want to bring your hand down to kind of block, that's totally fine. Whatever you're more comfortable with. I just like you guys to be comfortable. So these help with, you know, the pelvic floor. They compensate for the pelvic floor, sorry. When you're feeling tight, when you have the baby riding on the pelvic floor and everything else, I always try to do this, a little bit of muscle work on it. So that it'll feel a little better. Sorry, I'm thinking and talking all at the same time. Can you see the smoke burning? But,
Can definitely feel the tightness.
yeah. And it does help with the pelvic floor to loosen those up, to stretch your groin. Whether it's the stretch that we're doing later that you can do at home, and then we're going to adjust the neck. I'll show the stretch and then I'll show the KT taping at the end. But just going to kind of find some tension right in there. Just do a little bit of muscle work. You all right? Good. How's the little one?
She's good.
Yeah?
Frustrated she can't go outside today.
And it's not like you can take it anywhere.
No.
Everything's closed, you know?
Exactly.
With mine, that's how I feel. Just relax right there. Nice and easy. Relax right. My son like begs to go literally anywhere. The restaurant, you know, the grocery store.
Can I go with you to get gas?
Exactly. Can I just go somewhere? Can you stop at the gas station? Can we go in and get chips? Like, just to see other people? Stand up and go around. Tell me how that feels.
That's good.
Good. Okay. So the simple stretch. This is hard to do in dress pants, but what you do is you kind of like put your feet out and you kind of squat and push out. I won't do too much because I don't want to split these pants. You know, I prefer that they stay intact, especially on. And then so kind of take your elbows here and just kind of push out. And it kind of stretches the adductors and everything else, and you kind of feel it open everything up, right?
Yep.
Okay, good. There,
Feels good.
it's a name, I can't remember, it's like Ashtanga. Don't ask me like what the yoga name is. I'm sure somebody can comment down below and let us know. All right, so what we're gonna do is we're gonna kind of tuck your shirt here, if that's okay. I'm gonna spray you with alcohol to take off any lotion or sweat or anything like that. If you're anything like my wife, she always kept cocoa butter or, you know, whatever else on, and the tape's just not gonna stick to that. And so you wanna kind of wipe it off and take a little alcohol to make sure the skin's nice and clean and dry. There are a couple different tape jobs that we can do. Some go on the front of the back, on the belly. Some go on the back, some go different ways. The first way that I taped her practically relieved it entirely, and she was doing great. So I didn't say, hey, let's spin the ball and see if this one works as well. We've just kind of stuck with it all the way. So I'm going to put just a nice little strip of tape right across here, and there's going to be a nice little 25% stretch in there, and then practically no stretch down at the end. You never want to stretch that last little inch or so because that it pulls at the skin and can create irritation to the skin. When I tape this, I have to go all the way past the SI. So the SI is going to sit here again, the sacrum, and then the ilium stands for SI joint. So we're going to tape up high and come down through it because when I stretch it, it will end up being all the way down there. And that's okay with you, correct?
Yep.
Okay, perfect. So what we're going to do is kind of tape it all the way down past there. And then you just kind of want to take your hand over all of it to make sure that it sticks, because a lot of these glues are heat. And whenever you tear it, you just want to kind of, that's the one thing, all these classes that I've ever taken, KT tape, rock tape, you tear like that because it makes it easier than trying to peel it. And then all you got to simply do is flip it back. You grab this little corner and that little corner. And then it's really simple so that you don't have to touch it at all. Trying to do it so that you can see it. I'm doing a little backwards handed. And again, no stretch at that top. And then we're going to do about a 15% stretch down. And I'm trying to keep it down underneath where I'm not showing everything to YouTube. So the tape will go kind of all, I can feel it all the way down here and then all the way down here. And it kind of grows a nice X and kind of crosses those SI joints as well as that low back. And then stand up for me, so tell me how it feels.
Oh yeah, can already feel it. Yep.
Right, and nice and supported and everything's good. That's what we should expect to feel and see. Thank you. Subscribe, like, comment for anything else that you'd like to see.